So in today's video, we're gonna do a kind of quick overview of Listeria, the clinical signs you'll notice, the treatments, and kind of prognosis overall. So first off is the clinical signs. Most of the time you're gonna start to notice neurologic signs, which are things that include they might be a bit stumbly in their walking, they might have their head hanging low, they might not be able to blink on one side, they have trouble chewing, trouble eating. The other big sign is going to be having a fever. So every farmer, producer, pet owner, goat owner should own a thermometer. That is very important. So you'll be able to take a rectal temperature and see what it is. You know, anything over 103 is kind of what I consider a fever. So for that, if you notice any of those things, make sure you call your veterinarian. It's very important to have a relationship with a veterinarian before your goats get sick, because they're going to be able to advise you over the phone. If you go and call a nearby veterinarian and they've never been to your farm, never seen your goats, legally they cannot give you medical advice, and neither can I, because I've never seen your animals. But this is just an overview of Listeria in and of itself. So you'll notice those things. The biggest thing that's going to be helpful is noticing these signs ahead of time when they're very small and minor, because it can progress to get worse at the inability to stand. Once you have this inability to stand, the prognosis or likelihood they're going to survive is very small. Ones that have been down, it takes a lot of time and effort, and most of the time they don't make it, probably at least half the time once they're already down. And it becomes a lot of work on the farmer producer. If they're pets, yes, it's a little bit more likely you're going to do the work. If it's a animal that you're using for meat or dairy and you're using it as a business, it's a lot of cost that goes into it. So those are kind of your clinical signs. Treatment wise, doing it and having a veterinarian is going to be really helpful, because they're going to be able to give you doses, what medications to use. So very important is going to be antibiotics, thiamine in terms of vitamin wise, and then something for anti-inflammatory. This can be either a steroid or an NSAID. I have been using, for my Listeria ones I've had recently, I've been using NSAIDs just because steroids sometimes make me a little nervous, decreasing the immune system, but then that could be a good thing. I just don't personally have experience with the steroid side of things. And then antibiotic initiation is going to be really important as soon as possible. This is going to be with, at minimum, an antibiotic in the muscle, something like penicillin, at a dosing frequency depending on what your veterinarian will tell you. And then ideally doing IV antibiotics is going to be crucial to having a better outcome for your goat. Once you've got that started, the thiamine injections are going to be also really important. Anytime you have a neurologic goat, using thiamine is going to be pretty crucial to make sure that we're at least covering all of our bases. On the anti-inflammatory, steroid or NSAID helps to bring down some of the inflammation. The other part that's really helpful is if you have a veterinarian that can place an IV catheter and is kind of keeping up with hydration is big. Sometimes these guys can't swallow really well and they can get really dehydrated, especially if they're drooling a lot. That's really important to keep on top of. And then also sometimes you do need to do medications like probiotics to help combat the use of the antibiotic, and then also giving food orally if they are able to swallow. You can blend up really well some grass from outside, some hay stretcher. Try not to do grain because that doesn't support the good gut bacteria that we want in the rumen. So those things are going to be really important in managing these guys, and then making sure that they stay standing. If they are down, you do need to make them stand pretty frequently to make sure that they're not, their rumen's actually able to expel gas, as well as they're not getting any damage to their muscles. So that's going to be really important and key to making sure that they do better overall. So that's kind of the general overview, clinical signs, treatment, and prognosis. Make sure you have a veterinarian. If you don't, please find one in your area. If you don't have a large animal veterinarian, see if there is a small animal veterinarian that would be willing to help work with you, establish a relationship. They're not going to be the most knowledgeable, but they've got the basics. They can look up and research the things that we can't find on Dr. Google. So If you have a goat mentor, that can also be helpful because they can at least advise you on what they've done. Some states, antibiotics are not able to be purchased over the counter that you can use for this disease. A lot of states do still allow the purchase of the 2 medications that you can use for this disease. So that's kind of the mainstay of overall. So if you have any questions, you can leave them in the comment below, and if I can't answer them, I will. I cannot really talk about dosings overall, as I am a veterinarian, but I am not your veterinarian, so make sure you have one. Thanks for tuning in.